Hello, everybody. Good afternoon. Can people hear me? Okay, good afternoon. I think I'm okay. Okay. So, good afternoon, everybody. Hello to everybody from Bicol, everybody joining us from the community. Um, my name is Richard Cruz, and I'm a professor at the Asian Institute of Management. And I'm very happy to be with you this afternoon to talk about a topic called innovative thinking to overcome COVID 19. Okay. So, um, I'm sure for many of you, it must have come as a shock that many of these events happen very quickly. In fact, the first time we talked about it at AIM, the first time that I talked about it at AIM, COVID 19 was about mid January when I was talking to some of the EMDRCM students that we have. And I was asking them what was their preparation for COVID 19. And unfortunately, during that time, Taal volcano eruption just happened, and a lot of people, I think in Manila at least, or at AIM, we were quite preoccupied with um, the events surrounding the eruption of Taal volcano and the subsequent ashfall around southern Luzon and Metro Manila. But I think still sometime in mid-January, we were already talking about what was happening in China, and we were beginning to accumulate information about what was happening in relation to COVID 19. And when we started tracking the events, actually, this was around the time that DOH was just beginning to um, formally organize their information around COVID 19 cases, mostly at the time coming from travelers from abroad, from China, um, from Japan, and other places. Okay. So, I mean, on one hand, I wouldn't say that we were taken completely by surprise, but I think that because we've never ever experienced anything like this in our lifetimes, including most of our government officials, most of the leaders of our organization, since we haven't experienced something like this in our lifetime, maybe the best reference we had in the past was what happened to SARS or what happened to MERS-CoV or more recently Ebola. But since this disease is uh, much more communicable and actually is difficult to trace, it's actually something that can spread even among people who are asymptomatic. It made it really difficult, I would suppose, for people to imagine how much kind of preparation they would need to prevent further infection and further spread from COVID 19. Okay, so our session this afternoon is really about um, talking about COVID 19. Okay, I don't know if you can see it on the screen. I'm trying to show the screen. Okay, can you see the screen? Okay, so our talk is really about understanding the kind of innovative thinking we need to overcome COVID-19. Okay, and I wanted to start off by talking about um, the amount of work that we've done in the past, working with many different companies in the realm of innovation. So I would say for the last 10 years, personally, I've been involved with many organizations, particularly in the fields of transformation towards customer centricity, okay, using design thinking, using business model innovation. Okay, so we use design thinking primarily. At the beginning, we use design thinking to uh, innovate products and services. And then eventually, we use design thinking to innovate business models. Okay, so if you look at many of the business models, we've moved away from the traditional manufacturing and the traditional service models. And now we actually have very powerful business models like the platform business model. But right now, we're also using design thinking in the context of designing change at the societal level, okay, or at the community level. So this is about thinking about how to innovate the delivery of products and services across different organizations to have a broader impact on the bigger society and the bigger community. Okay. Okay. There's no screen. Hold on. Okay. Okay, I'm having difficulty sharing my screen right now. I think maybe I used the wrong browser. But I'll send everybody a copy of this slide. Actually, I'll send it right now to Carmel. And I think what Carmel can do is she can post it online. So while I'm discussing, you can have a copy of it. So I apologize for that. Okay, so I just sent the link to Carmel. Okay, so basically, the premise of this talk this afternoon is to leverage the experience we've had over the years working with many different kinds of organizations, both government, private sector, NGO, in the fields of business model innovation, product innovation, service innovation, and using this now to have a conversation about what we call transition design or using design thinking at the systems level. So this is the academic background. The topic though is what kind of innovative thinking do we need right now to overcome the challenge of COVID-19? Okay, so I guess the first question really is, since we're not medical experts, we really just need to understand first what the stated strategies are in relation to COVID-19. Okay, and based on epidemic experts, medical experts, they've put forward several strategies that I would say are quite novel in this particular case, or have been benchmarked against prior experience, both in prior epidemics or in countries that have been affected by the COVID-19 a little bit sooner than us. So more specifically, we're talking about China, South Korea, Singapore, and what we're seeing now in Italy, and then some other countries that are ahead of us. Okay. So in general, the strategies can be summarized into several areas. Okay. So let me just first talk about what normally do we do to fight a virus. Okay. So normally what we do to fight a virus is we get vaccination. Okay. So a vaccine will help us develop the immunity that we need to protect our body from that particular virus. Okay. But because this is a novel coronavirus, the vaccine does not exist. So when we talk about the innovation in relation to developing the vaccine, this is really a technological innovation. And people who have information in relation to the mapping of the RNA structure and how to develop a vaccine to protect human beings against the virus, that's basically a technological innovation. And the latest news says that the best case or the expected case scenario in relation to developing a vaccine for COVID-19 is probably going to be around the summer of 2021. Okay, so you can imagine that for many of us, we will only really have access to the vaccine sometime middle of next year. Okay, so more than 12 months from now. So the time it takes to actually discover the vaccines, to test the vaccines, to get it approved, to manufacture it, and to distribute it, okay? So it involves technological innovation, but it also involves a lot of other kinds of innovation as to how to scale that vaccine as fast as possible throughout the world, okay? So in the absence of the vaccine, okay, so you can imagine that we will be without a vaccine for at least 12 to 14 months. So in the absence of the vaccine, what strategies are we going to implement to protect society, but at the same time, hopefully, to get the economy back on its feet again? Okay. And we have heard of several terms. And the real issue is, how can we use innovative thinking in trying to execute some of those strategies that we've been hearing about in media a lot lately? Okay, so let me talk about one early strategy, okay, which was basically the strategy that was used in South Korea and Singapore, which is really the strategy that involves a lot of testing, identification of infected individuals, tracking who these individuals were in contact with. So this is the contact tracing element. And then after identifying all the people who have the virus, really trying to isolate them and get them to quarantine so that you can protect the rest of the community, okay? And this early aggressive strategy that requires a lot of testing, a lot of contact tracing, they were able to do it actually in South Korea without much of a shutdown. So they didn't really go through the similar experience that we're going through right now, which was a shutdown. Their strategy was more of what we call the containment strategy. Okay, so can we still identify people in society today, in our communities today, that have the infection, and can we find a place to humanely keep them separate from the rest of the uninfected parts of society until all the number of infected cases become zero and the virus disappears from our community. Okay, so this is actually what's happening now in Wuhan. This is what's happening now in South Korea. And this is what's happening now, or that this is what happened in Singapore. So the question really is it still possible to contain coronavirus 19 in the Philippines? Is it still possible to contain coronavirus 19 in the Bicol region? Okay, and what kinds of innovations would it take for us today to effectively execute a containment strategy? What kinds of infrastructure needs to be in place? What kinds of testing systems need to be put into place? What kinds of organizations need to be put into place so that we can effectively, efficiently, humanely execute a containment strategy. Okay, so I would say if you follow me on Facebook, I think as early as last weekend, I was already pointing out on my Facebook page that there has to be a lot more transparency when it comes to the plans by government in relation to how aggressive does it plan to test. Because right now the policy is you will only be tested unless you have symptoms. Okay. Apparently, from my understanding, that policy is not aligned with the strategy called containment. Okay. Testing somebody who is showing symptoms is basically more of part of the medical diagnosis that will determine the course of action, how that person will be treated, but is not necessarily related to this conscious desire to contain the virus to a certain part of the population. Okay, so I would say that I believe it's still possible to do containment. However, there's a lot of innovation that needs to be done to do containment. Okay, and we can talk about that a little bit more in a bit. I want to move on first to the second major strategy that people are talking about when it comes to COVID-19, which is basically what we call flattening the curve. So flattening the curve is not exactly the same as containment. Flattening the curve has this implicit assumption that a lot of people will be infected eventually, that you cannot stop the spread of the virus throughout the community. And the primary objective of flattening the curve, as you may well know already, if you've been listening to media this whole week, is that we're trying to slow down the spread of the virus. We're trying to protect the most vulnerable members of our communities, and we're trying to slow down the spread of the virus, reduce as much as possible the amount of people being infected so as not to overwhelm the capabilities of our healthcare system. Okay. So this whole need for extreme quarantine, social distancing, isolation, these are all related to this strategy called flattening the curve. And if you've been following the press conferences the past week, I think the insight that I've been getting, mostly the feedback that you get from government, is that they feel that there have been a lot of problems in relation to executing the strategy called quarantine, whose outcome is to flatten the curve. And the reality is, if you're not going to do containment, then you really have to do flattening the curve. You really have to have a very successful lockdown or quarantine type of operation. But we can clearly see that there are still gaps within our society that are having a very difficult time complying with the lockdown or the quarantine. And for many different reasons. Okay, there are some reasons related to their work. A lot of people are involved in working in vital industries, essential industries. There are reasons in relation to livelihood, that there are a lot of people who live on a daily kind of pay, daily wage, and therefore they need to go out to earn something so that they can buy food. There are many people who don't have the ability to store a week or 2 weeks or a month's worth of food in their house, so they have to go out fairly often to get food. So the reality is that when you look at many people in our society today, many of them don't really have the ability, nor the resources, nor the capabilities to follow exactly what the government wants them to do, which is to stay at home and not go out. So there are real problems that require innovation. We need to take care of the daily wage earners. We need to take care of the people who go out and work every day and protect them from infection. We need to help barangays and LGUs deliver critical services so that they can alleviate the pain of a lot of citizens so that they will stay at home. So there are a lot of innovations, social marketing, campaigns needed to help people focus on just staying at home and social distancing. On the other hand, there is a need to think more innovatively in relation to how we can improve the capacity of our healthcare system. Okay, and it's not just improve it or increase it, but to defend it. So we know that we have to keep the healthcare workers healthy and safe and protect them from infection. So this is where the PPE comes in. So there's a lot of innovation required to protect healthcare workers from the virus. There's a lot of innovation needed to continue delivering medical services for other ailments aside from COVID-19. So there are many cancer patients, dialysis patients, tuberculosis patients, diabetes patients that still need access to critical care in this time, but however, they're being crowded out by efforts to provide capacity for COVID-19. So we need a lot more innovations in relation to access to dialysis, access to medicine, access to medical services, medical practitioners. So I would say right now that our ability to cope and to minimize the amount of human loss is really dependent on our ability to stay away from one another. However, in the meantime, the challenge really is that our economy is being affected because a large part of the economy is really dependent on human interaction. Okay. So from my perspective, and I've been sharing this with many students already from AIM throughout the whole week, business will not return to normal most likely this year. Because if the vaccine is not going to be coming out, I mean, unless the vaccine comes out sooner, if the vaccine will really come out in 2021, it would be difficult for me to imagine that social distancing will go away anytime in 2020. So for all business owners, for all NGOs, for all LGUs, we really have to try to reimagine how day-to-day living can go back to as close to normal as possible, but with certain constraints that will continue, such as social distancing, such as perhaps for some people isolating, reduction of travel, etc., etc., etc. So many of our industries, like the tourism industry, will have to be reimagined. Okay, I have serious doubts, especially now that the Olympics have been canceled. I have serious doubts whether foreign tourists coming into the Philippines can still be a significant driver of revenue for many businesses for the rest of the year. So knowing how Bicol is an emerging tourist destination, the question really is, for example, for many industries in Bicol, how can we ensure that Bicol's economy will continue to thrive and grow? Because you do have a growing population. How can it continue to thrive and grow in the context where many businesses have been hurt badly by the shutdown right now, and there's a lot of uncertainty when it will reopen? And most probably social distancing will be the rule for the rest of the year. Okay. So there's a lot of innovations that are required. And I don't know if Carmel has already posted on the page the file that I was supposed to share with you on the screen. But if you have a link already to the file, you'll see one of the slides in there. It really talks about the different kinds of innovation that we need to pursue so that we can overcome the challenges of COVID-19. So this talk is not only about the immediate challenge within the next 2 to 3 weeks, but this talk really is also about the challenge of ensuring that our communities will be able to recover, hopefully better, after the quarantine is lifted. So you can imagine, hopefully the quarantine will be lifted in a month or so, and businesses will be allowed maybe to reopen, but they will not necessarily be allowed to operate the same way that they used to operate, given that there probably is going to be some kind of social distancing requirements, etc., etc., etc. So there are several kinds of innovations, and there's a slide there that talks about 5 kinds of general innovations that are needed, that we should think about, so that we can deliver products and services to all the different parts of the country in a new way that is both valuable, but at the same time protects everybody's health and protects people from the virus. Okay, so I'll just go quickly through the 5 types of innovation. Okay, so from a government perspective, the first kind of innovation really is a policy innovation. Okay, we need policy innovations in many different areas. Okay, so one clear area that will need policy innovation, more improvement, will be how will workers engage with employers? How will employees engage with employers? So we have this term called work from home. My guess is that work from home will become a more normal kind of arrangement between employers and employees. I think a lot of employers who have good experiences with their employees working from home might consider continuing this. And the reality is that for many people, this might be a more attractive opportunity moving forward. So, the institutionalization of work from home and how homes will adopt. So, meaning what kinds of infrastructure needs to be in the home, better telecoms, maybe a redesign of the homes to have more dedicated spaces for work from home. More people perhaps will be able to join the workforce. So, from a gender perspective, we can say that perhaps more women who were maybe excluded from some jobs because they were committed towards taking care of their children now can rejoin the workforce. So I can foresee that somehow as we try to create these solutions that are addressing a lot of the short-term problems right now, some of these solutions will actually be also addressing long-term problems that are identified to be part of the Sustainable Development Goals. Okay, so when you look at several Sustainable Development Goals like zero poverty or reducing poverty, gender equality, responsible consumption and production, I think that you can see that because of COVID-19, basically COVID-19 was the event that forced people into a change. But the long-term solution that we decide to keep could actually be not just a response to COVID-19, but these long-term solutions have the opportunity to solve longer-lasting, deeper societal problems. Okay, so we will probably see the creation of new kinds of businesses with new business models. Hopefully, we will see closer connections between farmers and markets, and perhaps through technology, the reliance on the middlemen will decrease, thus hopefully increasing the amount of income that can be shared with farmers, thus increasing the amount of cash that can be sent back into areas of agricultural production. So I think perhaps for like Bicol, this is very critical that more money that is actually generated through the sale of their produce is actually shared with the farmers so that they can reinvest in their own resiliency more moving forward. Okay. Of course, the second area would be in the healthcare industry. Um, so there's going to be a need really to rethink how policies in the healthcare sector need to be adopted. What minimum levels of healthcare should be provided to people, and how should hospitals be governed, and what are the rules in relation to the development of and the investment in hospitals. Also, in the development of the human talent around medical, nurses, doctors, apparently our ratios seem to be low compared to the rest of the world. So there's a whole slew of policy innovations that are needed to address many critical sectors such as industry, agriculture, healthcare, let alone education. Okay, so the first general area will be policy innovation. Okay, the second area of innovation will be institutional innovation. The question here really is, do we need new types of institutions to help us manage the risks that our communities are facing? Okay, so I'll give you an example of what is the innovation in COVID-19 of a new institution. Okay, it's called the IATF, the Interagency Task Force. So the Interagency Task Force is an example of a tangible institutional innovation, meaning there was no existing organization prior to COVID-19 that had the capacity or the scope or the authority or the information to make decisions or recommendations to the president in relation to how to cope with the strategies needed to overcome COVID-19. There was a need to create an interagency task force ad hoc. And really, the question is, when did they realize that they needed this kind of new institutional innovation? And how much preparation actually did the members of this interagency task force have in relation to their participation in the interagency task force? Okay, so I would say that it's a good thing that they thought about creating the IATF. However, it's a shame that they did not think about creating this sooner in anticipation of an epidemic. And second is, the question is the membership in the IATF sufficient? I'm sure that everybody who's inside the IATF right now should be there. But the question is, are there people or are there organizations not part of the IATF right now that should be in the IATF right now? So we can see that in terms of the need to coordinate the response, to have like a one government or a one country response, perhaps there could have been opportunities to include more representatives from business, more representatives from civil society, more representatives from higher education, and other sectors of society, maybe media, so that issues could have been discussed faster in the context of an IATF, so that they can actually mobilize resources faster and then make decisions quicker. And of course, the other question is in relation to this IATF, this institutional innovation. The question really is: so how do they work? What kinds of tools and processes and workflows do they use? How do they make decisions? How is the governance structure? How is the transparency? How is the information sharing going? So there's a lot of questions in terms of how this institution actually operates. But I would just say that in 2020, this is the best example of an institutional innovation. So my question would be, especially our guests from Bicol, would be, do you foresee that for this year, there is a need to create new bodies or new groupings or new institutions that would be better in relation to making decisions to help the Bicol region cope with the challenges of COVID-19? Okay, so that's the second type of innovation that we're talking about. So the first one was policy innovation. The second one is institutional innovation. Okay, the third one is technological innovation. Okay, so the reality is, when new institutions create new policies and there's new space to create new solutions, then tools have to be created. The new tools to execute the strategy need to be created. And that's where the technological innovation needs to come in. So there's really a need to rapidly leverage existing technologies in different fields so that they can be applied to solutions in the short term. Okay, so I'll give you an example. I know, for example, let's give the example that you see in the press. We know that there's a testing kit that was developed locally by a Philippine startup. And the question really is, so how can we ensure a local supply of testing kits in the near term by making sure that proper investments are being made to bring that technological innovation and productize it and convert it into a testing service so that people can benefit from it. Okay, so I think as each day goes by, this process is becoming more transparent. So this is basically the process of bringing that technology into the market. Okay, there are other technologies. I know DOST has been studying low-cost ventilators for some time now. I know that they funded studies where we do have local inventors who have developed local versions of ventilators, but they're still in the prototype stage. And the last time I checked on it recently, I know that it's still stuck somewhere inside the bureaucracy. Okay, so, and I've seen a lot of groups using 3D printing, additive manufacturing. For sure, I know that a lot of our IT-enabled sector, they're developing apps, websites. Hopefully, in the future, they'll be developing new digital tools data analytics. Okay, so all of these technological innovations that will be used as part of product and service. That's the third. So the first is policy. The second is institutional innovation. The third is the sources of technological innovation. Now, the fourth is business model innovation. So, who are the organizations, whether private, for profit, private, non-profit, or government, who are the organizations that will bring these technologies and convert them into a product or service and then bring them to the market? Okay. So, for many businesses now, they really have to shift their business model from what they used to do and shift their business model now into products and services that are needed by a population that is now under quarantine. So I know a lot of manufacturers are trying to shift their business towards the products that are needed during quarantine. There are many services that right now are not accessible to most of the population. And if we think about after the quarantine, we really have to think about new business models for both profit and non-profit, so as to ensure that new types of products and services can be delivered. Okay, so this is the fourth kind of innovation. Business model innovation, moving from the old business models now maybe to more sustainable business models. And the fifth innovation is basically the innovation about ourselves. Okay, and this is called conceptual innovation. Conceptual innovation is really how we think about the world, how we see the world, how we understand what's happening in the world. So in my slide, you're going to see there's a chart there that talks about the Canefin model. It talks about best practice, good practice, emergent practice, and novel practice. And basically what it's saying is that because the world is becoming more uncertain, we really need to spend time understanding the different trends in our society. So there is really a need to change the way we see the world. We cannot see the world using lenses that were developed 10, 15, 20 years ago, or even 5 years ago or 2 years ago. We have to, in 2020, refresh the way we see the world. So a lot of what we do in school actually is to have conversations with different people so that we can try to understand the world in a new way that is relevant to the current time. Okay, so some of you might say that this is trying to develop clarity or vision in a VUCA world. So that's one other innovation. It's called conceptual innovation. Okay, so it's about changing the way we think, changing the way we speak. Okay, changing the way we speak, changing our tone to one another, innovating our relationships with one another, innovating our feelings toward one another, and eventually innovating the way we work together. I think the bottom line here is that the virus is spreading exponentially. And if we want to keep up with the virus, then human beings and organizations in the Philippines, in Bicol, have to understand how can we also respond in an exponential way. In an exponential way. So if you talk about the virus and you say one person who has the virus can spread it to 1 or 2 or 3 people, in the same way, innovators or people who have solutions to problems, when they find the solution, they have to infect other people with the solution once, twice, 3 or 4 times as well. Meaning we have to also work in that kind of mindset. But the only way we're going to be able to work in that kind of mindset is if we change the way we listen to each other, if we change the way we talk to one another, if we change the way we feel about one another, and if we change the way we work with one another. So all of these innovations are what we call conceptual innovations, and that's the 5th kind of innovation. So just to review in our very short 1-hour session, and I'll take some questions in a bit, but just to review, when we talk about innovative thinking to overcome the challenges of COVID-19, right now I can say that we can summarize it into 5 kinds of innovations. Okay, the first one is policy. Policy innovation from government, from different levels of government, from different departments of government, from LGU, from barangay. We need innovations in policy. So the question is, how are the leaders of the NGUs and how are the leaders in government going to learn how and figure out what are the best ways or what are the best policies to test or implement. Okay, and what are the strategies? So the first one is policy innovation. The second one will be institutional innovation. How can we organize different organizations so that we can have unique combination of resources so that we can solve the problem in a new way? Okay, so for example, I know that the government has recently activated regional task force. So perhaps in Bicol, there is already a regional task force, and my understanding is that it's supposed to be headed by the regional head of the Department of Health. So right now, my question is, how is that group being formed? Who are the members of that group? Are there private sector members of that group? Are there NGOs? Are there civil society? Are there higher education? How do they work together? How do they make decisions together? How will they implement the strategies together? Etc., etc., etc. So there's really a big need to understand how this institutional innovation is happening and how our organization and our leadership can influence how these institutions work moving forward. Okay, that's the second. And then the third, again, just to review, is technological innovation. So these are our scientists, our engineers. We have to continuously understand the work that they're doing, keep an inventory of the work that they're doing, invest in their work, and make sure that when the time comes and their technology becomes relevant, that there will be businesses that will take up all of that technology. Which leads us to the fourth innovation, which is really social innovation, the innovation of organizations, business model innovation, the innovation of products and services, and how these products and services will change in terms of delivery. Okay, so it's funny because last December we were talking about this in class last year in my executive master's in disaster risk management class. That don't you think that in the future relief goods should be delivered as if it was being delivered by Grab or Food Panda? And it was funny because that's not really how disaster relief goods used to be distributed. But now, if you look at it now, in the context of COVID-19, you see many LGUs already innovating and saying that relief goods will be delivered to the homes of the recipient, just like the way Grab would deliver food to a customer's house. And it's primarily because it's too dangerous to let the people go out the traditional way, line up in the street, get the relief goods, etc. So the business model of how LGUs and the business model of how NGOs deliver services will have to change. And a lot of it will be leveraged or centered around new technologies moving forward. So that's the combination between technological innovation and business model innovation. And then last, which is probably the most important, just to review, is the innovation of ourselves. Okay, the transformation of the way we think and feel and speak. So I would say that this is perhaps where the biggest contribution of AIM is in relation to developing new leaders who will lead both the sectors of development, business, resilience, disaster preparedness, etc. Okay, so our intention really is, our big contribution will be in the transformation of leaders and giving them new ways of thinking, feeling, doing, working, collaborating, building partnership, etc. And then hopefully they will be the ones to lead the other kinds of innovations, the business model innovation, the social innovation, technology innovation, institutional innovation, and policy innovation. Okay. So on that note, I hope all of you are well, and I hope that you got something out of this short live stream. So as you know, I'm stuck here in my house in Quezon City. I was supposed to go to Bicol there earlier this month. Unfortunately, we got caught. This is the second time we got caught because the last time there was a typhoon. When we rebooked it, there was coronavirus. So hopefully we will be able to go back to Bicol to do this in person. But in any event, I would be more than happy to go back on the group page and then answer any of your questions and maybe join some of the chat groups to talk about specific issues in relation to some of the topics we talked about this afternoon. Okay. So on that note, I don't know, am I gonna entertain questions right now or we'll do it later? I don't know if Carmel is still listening. Okay. So thank you. Thank you, Achi, for your comments. Thank you, everybody. Thank you. Thank you, Jamie. AITF is a knee-jerk tangible response. Yes, I agree. I'm very interested in this institutional innovation aspect. In fact, if you ask me for Bicol, I'm very interested to understand how you feel the current structure is. So I'm not talking about the personalities. I'm just talking about the structure. Is there need for a stronger regional approach to different things? No, a regional approach to disaster, a regional approach to healthcare, a regional approach to livelihood, to economic planning, to tourism. So if there is, and right now we don't really see a very strong regional approach, then maybe how the question is how can we strengthen that regional approach moving forward? Okay. Okay. So I'm gonna give everybody access to the link to my slides, and I would be very happy for you to send me any comments. Okay. So yeah, I can wait if there's still some questions. Okay, Angel, sorry that you missed it. Okay, so I guess some of you can watch the recorded version of this. Okay, so Jimmy has a comment. We also have to rethink on how we design our living spaces. It should be quarantine, lockdown. Yes. So, my first job was in real estate. So the reality is, I think architects, real estate developers, um, suppliers of home furniture, telco companies, they really need to, and even LGUs, LGUs need to get and develop new policies also, how to improve infrastructure, maybe create new types of businesses like very localized co-working spaces, shared working spaces with excellent internet, maybe very close to homes, but not exactly in the home, so that the children and the parents are a little separated. So there's really a lot of space for new business models here. Will we offer an online course for MDM? It's possible that we're gonna offer a blended. I mean, I think the truth is COVID-19 forced everybody to go online. A lot of people were resisting to move education online, but because now we don't have a choice, it's been moved online. So I think the reality is many people will prefer it moving forward. So we'll see what happens to schools at all levels, and to what extent will it move completely online or blended. Okay, so I think that's really going to happen. When is our next session? Yes, please. Let's organize. I will make sure that the screen sharing is better next time. This is my fault. Actually, they were just messaging me. I'm not with the rest of the staff right now, so I think I used the wrong browser. That's why I couldn't share the files. But most definitely, if the community wants, we can schedule another session. And if you have more specific topics, especially if it's focused on Bicol, I would be very happy to talk about that. Yes, Malu, I agree. Probably the most difficult innovation will be the conceptual innovation at the personal level. Unfortunately, when I look at the kind of conversation and discourse that you see on social media right now, there are many behaviors that I would suppose are not ideal for people who would consider themselves to be leaders of their community or organization, etc. So there's really a need to build deeper relationships. The reality is communities have to be more agile. And what agile means is that when a problem happens, parang the teamwork is already there. We can't just start building the teamwork after the problem happens. The teamwork should be built before the problem happens, so that if a problem happens, we already know each other in the community, and we can already work on creating new solutions in a very short amount of time. Okay, so there's a lot of trust that's needed, there's a lot of empathy that's needed, and there's a lot of understanding. And I would say that in Philippine society, these are the things that need to be developed: trust, empathy, understanding. So it's really going to be challenging, but hopefully, at least those who share the same values and share the same vision for not just Bicol but for the whole Philippines, that they will find it within themselves to have that kind of conceptual innovation. I just want to ask, so Joachim Pilapil, I want to ask, what should be the focus of policy in addressing the COVID-19 as per regional versions of the IATF? Okay, I think the reality is that most regions really have two phases. Unlike Metro Manila is homogeneous, that it's a very urbanized center. If you talk about Bicol, Bicol has both urbanized and non-urbanized, very rural areas. And I think somehow there's some scope in having a different way to manage the very urbanized and the rural areas in terms of social distancing to prevent the spread of COVID-19. And this needs to be studied more deeply. I'm not sure whether everybody has to be quarantined inside their house. That's one. And second, of course, is the testing and the isolation, the containment. If regions can have a better containment system, I think they can recover faster. You know, my hope for Bicol, my real hope for Bicol is that when the quarantine is lifted, that Bicol will be the destination of choice for many people from Metro Manila. Because number one, nobody will probably want to fly an airplane too much. Not as many people want to fly. So I don't think a lot of people want to fly to the traditional tourist destinations in the Visayas, etc. So my hope is that as the tourism sector rebounds, that Manila will consider Bicol to be one of its prime destinations. And the question will be, will the infrastructure and the organizations be in place in Bicol to receive all of these tourists who are looking for an escape from the quarantine without bringing the disease to Bicol? Okay, so there are many opportunities actually. So this is not just a bad thing, no. There are many opportunities for a place like Bicol to become the new destination given the current circumstances. It's just a question of, do people in Bicol have the foresight to plan for that and also to protect the local population? Okay, so yes, I agree, Fiona. Working from home will affect the traffic. So as you know, the demand for oil is down by almost 20 to 30%. And that's why the prices of oil are going down, because transport as a consumer of gasoline is really down. So I don't know how much of the traffic will return afterwards. I'm not sure even if the workers want to go back to work every day after experiencing work from home for several months. So maybe the focus of some companies will just be more how to improve the productivity of work from home rather than forcing all of the workers to go back to their office. I think the side effect of the quarantine is that actually many people will become healthier. Although what we're really trying to do is protect people from getting infected by the virus, and of course trying to reduce the amount of deaths from this pandemic, I think the reality is for those who will not be infected, they will probably come out of this healthier, hopefully. So that might be the unintended consequence also. And that might actually influence more people to stay home more and maybe just work from home in the future. Okay, so yes, AIM needs to innovate its business model to take into account better online or blended offerings. I agree. So probably blended is in the works. I wouldn't mind going to Bicol and running classes also in Bicol, making it more convenient there, and then maybe bringing other students from other parts of the country to go to Bicol to attend classes there, so that the classes are done closer to the real context of where development has to be managed. Okay, so Angel has a good question. The structure of disaster response is very political. It's very dependent on the LGUs. So what do you think should be the way to deepen the non-political relationship? So I honestly believe that strong institutional innovations among non-political organizations could be the good counterpoint. So strong associations between civic organizations. But the reality also is that even in civic organizations and even in CSO, NGO, there's also a lot of politics involved. The politics has actually gone into the NGO, the CSO, the higher education. So, it's really something that we have to deal with. It's just we really need to strengthen the governance and the transparency of organizations to ensure that the agenda of individual politicians or of individual leaders is not the only agenda that's being followed. That the agenda really is a agenda that has the common good in mind. Okay. The telco now are the main drivers for surge of online communication. Technological innovation for the existing carriers should now focus on speed. Yes. So I work with some of the telcos, and part of my advocacy among them is to become more conscious about how they can build new partnerships on the ground, so that by combining their telco with other resources, that they can create better telco. So yes, I agree. Actually, I think in the future, all houses should have its own video conferencing room already. So like if you build a new house, even if it's a small house, you should have like a very small content creation or video conferencing room as a necessity already, not just a hobby. Okay. And yes, I agree that government really needs to ensure that the telcos provide the right infrastructure. So yeah, Philip. Yep. I am a big believer in the Bicol tourism. I know that you will have a unique value proposition once the quarantine is lifted. You might be the most exotic and at the same time safest destination to go to for many people in Metro Manila. So I'm looking forward actually to visiting a lot more islands via land and via Roro. Um, and I think that's probably one of the first things I might do after the quarantine is lifted. So yes, I agree, Philip. What are the strategies how to recover much faster? I think you need to try to imagine what a post-quarantine world will look like with social distancing. People will still be afraid to get infected, so um, how to mitigate infection and how to ensure trust and credibility will be critical. Once movement is allowed again, people will move, but they will be careful in their choices. Okay. Okay, so thanks a lot, everybody. I had a great time. Um, I'm actually fully clothed. Okay, I'm wearing pants and shoes, so I really dressed up for the occasion. I'm not wearing shorts underneath. I won't show you, but I just trust me. I'm wearing pants and shoes. I just wanted to get into the right mood. The same way I would dress up in a case room at AIM, that's the way I'm dressed up right now at home talking to you on the live stream. Okay, so thank you very much, everybody. And please post whatever question or comment you have, and we'll make sure that we'll get back to you. Okay? So, on that note, I'm going to end it here. Thank you so much. Please take care of yourselves. Don't lose hope. There's so many things that we need to do. So, magpalakas kayo, be healthy, eat healthy, exercise, lose some weight, and get your mind ready. And then once we're all allowed to go out again, then that's the time that we'll start working with our hands. Okay, but now we can work this way. Okay. Do you think a city sharing of governments? Yeah, of course. Yes, Angel, I agree. Yes, I think that's the kind of institutional innovation that you're looking for. Okay, so thank you so much, everybody. Thank you. Have a good day.